Hi, my name is Erik Stratman. I'm an assistant high school football coach in central Wisconsin. I'm also a dermatologist for Marshfield Clinic Health System. Skin problems are some of the more common issues faced by athletes in any sport. Each year, I evaluate and treat a number of athletes for a variety of skin problems, including some infectious skin disease that keep the athletes from the field, court, or mat of play. In many cases, good sports hygiene and early appropriate at-home intervention can help minimize the interruptions in the athlete's sports season. In the next few minutes, I would like to take you through some of the warning signs that the athlete may be experiencing a communicable skin disease and give you some tips on early recognition, prevention strategies, and at-home supplemental care tips to get the athlete back to competition as soon as possible. Because official return-to-play recommendations can change over time, please refer to the current WIAA guidelines for treatment requirements and durations of treatment necessary for an athlete to return to the sport. The first condition, Molluscum Contagiosum. This infection results in little itchy bumps caused by a virus and commonly occurs in contact sports where athlete skin-on-skin contact occurs. These little tiny lesions may look a lot like blisters, but in fact they are not. They are often shiny with a little dimple in the center. They are often filled with a cheesy core. But be careful, that cheesy core is where thousands of viral particles are living, and that is how the infection spreads, usually after scratching. They can be destroyed in many ways, with the quickest being in a doctor's office using a small, sharp instrument called a curette, or cold spray liquid nitrogen cryotherapy. There are at-home ways to manage and prevent the spread of molluscum. First, try and avoid vigorous scratching at the lesions because this is a key way that the virus spreads. Also, avoid shaving over the areas if they are located where a person would normally shave. Over-the-counter treatments are possible and have been studied. Applying an over-the-counter 10% benzoyl peroxide acne gel to the lesions can cause enough reaction to eventually see these resolve with no medical treatment. Another tip for at-home care of molluscum is to tape strip the top of the lesions. Using the sticky side of regular clear cellophane tape, a person can tap repeatedly over the lesions. The sticky tape causes an inflammatory reaction in the molluscum, which leads to eventual inflammation and resolution, like the acne gel. Prevention of molluscum can best be accomplished by avoiding direct skin-on-skin contact with a person infected with molluscum lesions. Molluscum affects people of all ages and is not just spread among athletes with direct skin-on-skin contact. Condition number 2, Herpes Simplex. This is also known as the cold sore virus. This infection most commonly occurs on the face around the mouth. In athletes participating in contact sports, this infection can also occur on the trunk and extremities too. This infection can be tricky to diagnose, but most often appears as clusters of blisters and erosions in one or a couple of areas. These lesions are very infectious if the blister fluid or weepy erosions contact another player. Once the athlete has herpes simplex in their system, it may recur repeatedly throughout life. There are at-home ways to manage and prevent the spread of herpes simplex. Avoid casual, direct skin contact of the lesions with other people. Keeping the lesions covered whenever possible is a good idea to prevent the spread. If it occurs on the lips or around the mouth, avoid sharing drinks or straws or eating utensils with others. Future herpes simplex outbreaks may flare for several reasons. Athletes whose sports occur outdoors may experience flares due to sun exposure, the most common trigger of herpes simplex outbreaks. Sun protection, including lip balms with sunscreen, and minimizing extreme sun exposures can be helpful. Stressful physical or emotional times in the athlete's life may also lead to flares. For athletes experiencing recurrent herpes simplex outbreaks, a daily suppressive antiviral medication by mouth is sometimes indicated to prevent outbreaks during the sports year. Condition number 3, impetigo. This is a superficial type of bacterial infection most commonly caused by staph or strep skin infection. This skin infection commonly appears as a honey-colored crusting with superficial erosions on the skin. Pustules can sometimes be seen in the area as well. Although rarely dangerous to an athlete's health, impetigo can be very infectious with direct contact with the lesions or by sharing certain types of equipment, practice gear, towels, or other articles that may have touched the infected skin. At-home strategies for decreasing bacterial skin disease transfer and spread include soaking in a warm bleach water bath for 20 minutes. This is an excellent and affordable way to decolonize bad bacteria on the skin and to decrease the spread of staph infections. In a full bathtub of warm water for soaking the athlete, add a 1/4 cup of household bleach. This essentially turns the bath into a chlorinated swimming pool concentration of germ-killing soaking solution. Straight bleach on the skin should not be used as it is too toxic. Soak for 20 minutes in the tub, and that's it. Many topical antibiotics that can kill typical impetigo germs are readily available over the counter, typically for under $10 per tube. These can be used on honey-crusted open sores as first-line attempts to resolve impetigo. Prescription ointments are usually effective and sometimes necessary. For widespread impetigo or resistant cases, courses of oral treatments are necessary. Prevention of impetigo includes caring vigilantly for any open cuts or scrapes encountered by the athlete and minimizing scratching or picking at open skin lesions. A more dangerous, less common form of staph infection is called MRSA or MRSA infection. This is an infection by a resistant staph germ that usually lives much deeper in the skin, causing more redness, swelling, and tenderness. If the athlete ever experiences worsening red, swollen, and tender skin anywhere on the body, or fevers or feeling sick, the athlete should be evaluated by a healthcare provider promptly. The 4th condition, ringworm or tinea infection. This is a common type of superficial fungus infection of the skin, common on the arms, but can occur anywhere contact with an infected athlete has occurred. Sometimes these spots can have tiny pustules within the round lesions as well. Lesions can even occur in the scalp, which can be particularly difficult to manage because the fungus dives down the hair follicle. There are many sources of fungus, including pets, cattle, or infected close contacts. The lesions are usually scaly, red, and round. Special testing at a medical office can help prove that there is a ringworm infection. Prescribed oral therapy is usually needed to clear scalp infections. Over-the-counter antifungal creams can be effective in managing some early and limited forms of ringworm. Alcohol-based hand sanitizers also have a killing effect against most forms of superficial ringworm as well. Scales that shed from the skin lesions are infectious for a long period of time and are the prime cause of spread. Prevention of ringworm includes avoiding sharing items such as hats, shirts, towels, or hairbrushes. Launder affected clothing promptly and clean areas where scales might have dropped in higher concentrations. Thank you for taking the time to learn about these common skin infections affecting athletes. All of these infections require prompt assessment and intervention to minimize spread of infection and shorten the time to return to play. We all want the athlete to return to play as soon as possible. Good luck in your sporting contests ahead, and remember, we've all got skin in the game.